So last night we were advised of this new case. It is a doctor who assessed 2 COVID positive patients on Wednesday. Now, as everyone knows, we are seeing more people testing positive in hotel quarantine coming in from overseas, which of course we know that our hotel quarantine is that last line of defence. But then we move the positive cases into the hospital. So we know that this doctor who assessed these 2 COVID positive patients was at the hospital at the time. Now, she developed symptoms on Thursday and returned a positive test late yesterday. Now, the patients she was treating have the UK strain, but we do not yet know if the doctor has that same strain, but if we are expecting that to be the case. So contact tracing is underway. Dr. Bennett will talk in more detail and give the public some details about that. But now what we're asking everyone to do is that all hospitals, aged care and disability services in the Greater Brisbane will be closed to visitors, and anyone going inside would have to wear a mask in those places. So this includes Brisbane, Ipswich, Logan, Moreton Bay and Redlands. And of course this is precautionary measures that we are taking now, especially over the next 72 hours. So there is no need for the public in general to be wearing masks. We will be assessing this each day, especially over the next 72 hours, to see if we have any further community spread. But Dr. Bennett will explain that this has been very quick from the contact to the diagnosis, and unlike when we had the cleaner out in the public for, I think it was for 5 days, this doctor has not been out in the community for a long period of time. It's been very short and very limited in her contacts. So we'll be talking about that a little bit further. So look, I'll hand over to Dr. Bennett and then our Health Minister, and then we're happy to take some questions. Dr. Bennett.
Thank you, Premier. Good morning, everyone. So just to reiterate, we have a doctor at the PA hospital who has tested positive to COVID-19. That particular doctor was managing 2 patients that we know were confirmed to have COVID, and that was in the early hours of Wednesday morning. She did a subsequent shift at the PA hospital later that day into Thursday evening, and then late Thursday developed some very mild symptoms, and on waking Friday morning had a sore throat and did exactly the right thing and went and got tested immediately Friday morning, and the result was returned late Friday. So as you can see, a very quick chain of events, and we really want to thank that doctor for coming forward quickly and getting tested. Having said that, we do have a little bit of work to do with respect to contact tracing. So whilst she wasn't symptomatic when she was working at the hospital, we still, as you know, take a period before the onset of symptoms as being potentially infectious. And so there will be a big exercise in contact tracing underway at the moment as we speak at the PA hospital, identifying all residents, or all patients, I should say, and all staff who may have been in contact with the doctor during that time, and they will be managed appropriately depending on what contact they had, with some staff going into quarantine or patients and some being tested. So there's a lot of work to do over the next 24 hours. With respect to the community, the person was infectious in the community on Thursday afternoon and evening, and we will publish those sites shortly, but just so you are aware now, there are 3 high-risk sites. One is the Morning After Cafe at West End, where the person was there present from 2 p.m. to 3:15. Now, the good news is, as the Premier said, there's only been a short period of time infectious in community, and apparently the person was sitting outside as well, so following all the COVID-safe rules, so we can all be assured about that, and we should be fairly easily be able to identify through the contact tracing app who was also there at that time, and Public Health will be in contact with those people, and they'll be going into quarantine as well. The other sites are the Corporate Box Gym at Greenslopes, where the person attended between 5:45 and 7 p.m, and again, anyone there at the same time, and we understand there are in the vicinity of about 11 people will go into quarantine. And Stones Corner Hotel at Stones Corner that evening between 7 and 7:45 p.m. Now, all those venues are being very cooperative with Public Health, and again, a large amount of contact tracing going on as we speak, and we'll know more about the number of contacts in the next 24 to 48 hours. There are a couple of low-risk venues, and one is McDonald's at Cooperoo between 3:10 and 3:20, where the case did drive through, so that's what we would call low risk, and anyone there around that time will just be asked to monitor symptoms and get tested. But also the gym after 7 p.m. when the case left. We know that gyms are high risk and that transmission has occurred in gyms. So anybody who was there after 7 p.m, even though the person had left the gym, will be asked to monitor that for symptoms closely and get tested. So I think the community can be reassured that there's a lot of work going on, and because this has happened so quickly and we've really, the doctor presented and was tested quickly, and we've got the information about where she's been, anyone who is potentially exposed will be going into quarantine and managed, and we hope to prevent any further transmission in the community. Having said that, we all still need to remember that COVID is still with us, and so we have had an infectious case in community, and we just have to remind the public, anyone with any symptoms, no matter how mild, please go along and get tested. That really supports the efforts of the health staff and the public health staff and everybody else across government in helping to contain any community transmission. And just remember those things about using the COVID Safe app, checking in when you go into venues, physical distancing, hand washing, and all those sensible things that we know the community has been doing for some time. So thank you.